Hello everyone, welcome to sqadia.com, and in our final and fifth section of the lecture, Acute Pelvic Infections, we will talk about some other pelvic infections besides the pelvic inflammatory disease. In this, we will talk about some late sequel of pelvic inflammatory disease, and then we will talk about some infections that can occur following the gynecological procedures, and then we will talk about IUD and pelvic infections. So some late sequel of pelvic inflammatory disease is infertility is very common after pelvic inflammatory disease, and the reason why infertility is there because of the blockage of the fallopian tube, scarring and injury to the wall of the tubes usually can prevent the migration of the ova, and it can prevent the fertilization to take place. So infertility is common after pelvic inflammatory disease. Then chronic infections. If the infections keep on occurring again and again, it can lead to the chronic pelvic infection, and that's again the late sequel of pelvic inflammatory disease. Dysmenorrhea, difficulty or painful menstruation, is present after pelvic inflammatory disease. Then pelvic adhesions are formed due to pelvic inflammatory disease. Ectopic pregnancy. Ectopic pregnancy because of, again, due to adhesion formation. There is a migration problem in the ova, and then the ova is fertilized outside the uterus. So that can lead to ectopic pregnancy or pregnancy outside the uterus. Then also there is intestinal obstruction can also be present because of adhesion formation, and due to all these complications, usually the patient present with very ill health. There is generalized weakness, wasting, pallor, all these, anemia is there, so all these conditions are present. Dyspareunia is painful intercourse is present, and that can lead to marital problems also. So these are all the late complications of the pelvic inflammatory disease. Some pelvic infections which are present after the gynecological procedures. Usually the organisms involved in these infections are E. coli and Bacteroides fragilis, and how they can cause the pelvic infections is usually the vaginal curve is infected or indurated due to infected hematoma. Hematoma is the collection of the blood, and then this can lead to cellulitis, and then cellulitis can lead to abscess formation, and this infection can spread to cause pelvic cellulitis, thrombophlebitis, or tubo-ovarian abscess. So with the gynecological procedure, there is a formation of hematoma, which is the infected hematoma, collection of infected blood, which can cause cellulitis, and that can spread to the different pelvic structures. Treatment is again metronidazole intravenously 500 milligram 8 hourly for 3 days. IV ceftriaxone 1 gram during the operation, and 1 to 2 doses after the operation. Definitive treatment is appropriate antibiotic and drainage of pus through the vault. So this is the definitive treatment once the infection is present. But to prevent that infection during the gynecological procedures, we should give the prophylactic antibiotic like metronidazole and ceftriaxone. Next, what's the role of the IUD and pelvic infection? Intrauterine devices, IUDs are inserted into the uterus as a mean of contraception, and this is high IUD risk of is highest when the patient has multiple sexual partners. Some preventive measures that can be done is better to insert the IUD in nullipary or in cases with previous history of pelvic inflammatory disease. So, not in, one preventive measure is nullipary. We should not insert the IUD, and then any history of previous pelvic inflammatory disease. And then insertion should be carried out under strict aseptic condition. It's important to perform aseptic procedures, so infection should be avoided. Once the infection occurs, the device should be removed in addition to antibiotic and supportive therapy. And there is usually good response to penicillin if there is fungal infection present. So, IUDs can cause pelvic infections because of scarring of the endometrium, and it can cause endometriitis. Endometriitis can then spread to fallopian tubes, causing salpingitis, oophorytis, then peritonitis. So it's a serious condition. If infection is suspected or if it's present after insertion of IUD, it's always should be removed, treated with antibiotic, and if the condition is improved, then IUD later on can be reinserted, but it's better to go to the other methods of contraception once the IUD can cause pelvic inflammatory disease. It should not be inserted in nullipara. Nullipara are the women who never got pregnant or never deliver, or it cannot be inserted with previous history of pelvic inflammatory disease. Next, IUD and again pelvic inflammatory disease, how they can be managed. Treat pelvic inflammatory disease which is associated with IUD, counsel the patient that they should use some other method of contraception like condom. IUD does not need to be removed if women wants to continue IUD and woman wants to discontinue IUD. So we divided the group into two type of patients. One who wants to continue on IUD and ones who don't want to continue on IUD. How we manage these two groups of patients. Women who wants to continue on IUD, reassess them in 24 to 48 hours. If there is clinical improvement, then continue IUD. If there is no clinical improvement, then give them antibiotic, consider removal of IUD, and then offer them another contraceptive method. Women who wants to discontinue IUD, it's simple, then remove the IUD, start them on the antibiotic, and then counsel them and recommend them some other method of contraception. That was all about the IUD and how they can cause the pelvic infection. So, thank you for watching sqadia.com.